So this is going to be a quick overview of the components of the Well Child exam for a preschool age child. Now you remember that we expect the children's visual acuity to improve as they get a little bit older, and in the preschool age child, usually it's about 20/30 for the 5 and 6-year-old, and you definitely want to refer if there's more than 2 lines difference between the 2 eyes, or if children have less than 20/30 visual acuity, or if they still have any strabismus. So if your cover-uncover is positive or your corneal light reflex is not symmetrical. Now you remember from the dental and from the toddler exam that at 2 years the children typically have 20 primary teeth, and at 3 their second molars begin to erupt. Cardiovascular wise, as the heart gets bigger, it's beating or pushing out a higher volume, so the heart rate goes up and the pulse goes down. This is the most common age to hear functional murmurs, and that's just because their chest wall is a little bit thinner, they're starting to get a little taller, a little more slender, and you can actually hear the blood flow, which is that functional murmur. Respiratory-wise, the abdominal respiratory movements continue. They're still very much abdominal breathers, but their rhythm becomes more regular than you saw in the infant and toddler. And because their lungs are also getting bigger, the rate slows because they're able to oxygenate a larger volume when they take a deep breath. The other good news is their phagocytic activity of the mucus improves, so they're more able to fight off infections than the younger children could. Gastrointestinal-wise, the salivary glands become adult size by around 2 and begin to produce some saliva, begin to have some enzymes, and begin to digest some foods. The stomach capacity increases to about 500 milliliters in the preschool age child, and therefore they can take a larger volume at a meal. And usually the typical child So as the stomach increases in capacity, the children then are able to tolerate a larger volume, and they usually only require about 3 meals plus a snack or 2 a day. And a good rule of thumb for serving size of each food is 1 tablespoon per year. So if you have a 3-year-old, you give them 3 tablespoons of the macaroni and cheese, 3 tablespoons of the applesauce, and 3 tablespoons of the green beans, and that's sort of an average size serving. Their stools are now becoming a little more like the adult consistency and really depend on what foods they've taken. Renal-wise, the kidneys descend deeper into the abdomen, and you're not going to be feeling them. And the ureters remain short and pretty horizontal, so the children are still real susceptible to reflux when they have a urinary tract infection. So we try to treat those pretty promptly to prevent that reflux from occurring. And at 4 to 5 years old, they should excrete about 500 to 600 milliliters of urine per day. They are able to concentrate the urine a little bit more than the younger kids did, but they should have an adequate volume of urine that they're excreting every day. Musculoskeletal-wise, genu valgus is very common and developmentally normal, and you can see the picture of the little person on the right lower hand corner of the slide who has a typical preschooler gait with the genu valgus. There's also the possibility of fractures that go through the growth plate in this age child because the growth plate is the weakest part of their bone, and it can result in abnormal growth of the limbs. So if you have fractures through the growth plate, you want to be really mindful of watching how the child is growing, and those types of fractures should be referred to ortho. So endocrine-wise, the growth hormone is stimulating body growth, and the adrenal glands are maturing and are active with the stress adaptation response. And so children are a little more able to respond to illness and that sort of thing just because the stress response is more mature. We also know neurological development continues, and if we think about gross motor, fine motor, social, and language, gross motor, we expect preschoolers to be able to jump in place. They should be able to ride a tricycle, should be able to go up and down stairs, run pretty well, kick a ball, skip. Those are all activities that we expect to develop for the preschooler. Social-wise, they should develop some self-care and be able to dress and feed themselves, and their imitation of parents is really strong. So like the little guy in the middle of the lower part of your slide, he's helping his parents rake the leaves, does a lot of imitation. Language-wise, the preschooler should know their name, age, sex. They should have the disfluencies that they may have had as a toddler begin to disappear around age 5, and we expect their speech to be clear and more fluent in the preschool age. Fine motor, they should be able to copy a circle and a cross by the time they're 3, and draw a person with 3 or 4 parts by the time they're 4. Let's just review also the developmental theories. Remember that you want to think about Freud, Erikson, Piaget, Kohlberg, and Gilligan with each different age group. So Freud refers to this age group still as the Oedipal stage, and early childhood experiences and their emotional life really help shape their personality. And each stage they resolve around a particular psychosexual conflict in the preschooler. So Freud talked about the emotional life having powerful influences on behavior and development, and that it was an unconscious process that shaped their behavior, and that interactions between the parent and child really influence the kid's personality, resilience, adjustment, and behavior into adulthood. And then finally, he really talked about the individual's life history is unique and worthy of study and understanding. So Freud specifically called the 3 to 6-year-olds as preschool age of the Oedipal or phallic stage, and talked about the emphasizing the identification of their sexual self, and that the child derives pleasure from genital stimulation, and that there's this Oedipal-Electra conflict that results in identifying with the same-sex parent. So Erikson talks about it being the stage of initiative versus guilt, and they talk about the underlying assumption being the child can be trusted to obey the inner laws of development, and that child rearing is a child response event rather than a prescriptive or an adult-directed process. So Erikson also thought it was the initiative versus guilt was the 3 to 6 age group, which is the preschooler, and that make-believe play really helped the kids to learn about roles and values in society, and that initiative involved a sense of ambition and social responsibility that developed when they began to be supported by their parents and when their interests emerged. So they like to make things, they like to try new things, they like dress up and imitation play. And the parents can impose too severe demands for self-control on the child, which can really cause a problem with the kid's desire to search out opportunities for growth. And so we caution parents about being too demanding or expecting too much from the preschool age child. Piaget also talked about the stages of reorganization of thought that are influenced by adaptation, and by acting on the environment, children construct a higher level of knowledge, capabilities, and actions, and that the environment can enhance or impede their cognitive development. And so we really want to put them in a safe environment where they can explore safely and learn and enhance their cognitive development. Piaget also talked about the parents' role in setting the stage for their development every day, and that the kid will go at their own pace and they should be free to explore and discover. And Piaget broke the development down into several stages, with the pre-operational stage being this preschooler age group, and they're very egocentric still. They're concrete thinkers, but around the age of 5 to 6, they begin to develop this concept of conservatism, and they can actually understand eventually that a short, larger, round versus the tall, thin glass beakers could potentially hold the same amount. And that's that concept of conservatism. Piaget also talked about the pre-operational stage and that egocentrism, with the 2 to 7 years being that whole pre-operational state, and that there was this increase in symbolic activity. So they have a development of language and the imitation and the make-believe and their mental images of the actions and events, and that their thinking can be kind of rigid and illogical and inflexible, but they are definitely egocentric. They think everybody thinks like they do. They also have this concept of animism, and that objects have thoughts and wishes and feelings, and usually are similar to the child's thoughts and feelings. And an example of that is Jeffrey, age 3, who said the sun is angry at the clouds and has chased them away. So the animism begins to fade as the causality begins to develop. So you'll have the inanimate objects possessing human qualities in the younger preschooler, but when they get a little older and they're able to really see the link between cause and effect, then that animism is no longer the explanation. So now they start asking why all the time. And they really want to understand. They're trying to further develop that whole idea of causality. So Piaget and that pre-operational thought also emphasizes that preschoolers are distracted by the physical characteristics of objects, and that they're unable to use the concept of conservation initially, but they will develop it, and that's we talked about that a few slides before. They also begin to develop the concept of centration and irreversibility. So just as they get a little older, they can begin to understand some of these more complicated concepts. So Piaget talks about this period also being not associated with logical operations. So they don't really get how to classify things yet. They can't really organize things into classes and subclasses, and they really have difficulty with ordering things or seriation. They can count, but they can't always put things in order, and that will just develop with time as they enter the school age period. Kohlberg really talked about the pre-conventional level being the punishment and obedience, because they didn't want to get punishment in the toddler. They follow rules just to avoid punishment. But then, and that's that pre-conventional level. Then the conventional level, they begin to understand that the actions are associated with being considered a good boy or a good girl, and the social order is an important concept. What's acceptable behavior and what's not. And then the post-conventional is the social contract and the universal ethical principles. What's the right thing to do? So they talk about, Kohlberg talks about the stages of moral reasoning, which builds on the preceding stage, and it's a forward progression. It's discontinuous, so they might jump back and forth, but remains fairly stable over time. And then the moral reasoning develops due to inconsistencies and inadequacies in life. So when we're talking about the pre-conventional level by Kohlberg, morality is externally controlled, and preschoolers justify their actions as right or wrong on the basis of whether or not they lead to pleasure or punishment. Now, remember we talked about Carol Gilligan, who thought the previous developmental theorists were all men and based it on observations of boys, and she really felt that some things were different with girls. And she really talks about the ethic of caring and focusing on mutual trust and affection, and emphasizes the empathetic perspective. So when you're doing your developmental assessment of the preschooler, you still can use that ASQ, which is a very validated, good tool to use with this age group. As you know, it goes up to age 5. So it can be used, but you still want to be doing some observation and some questioning of the parents around their language, gross motor, fine motor, personal, social. So what sorts of things do we worry about with the language assessment? We want to think about the child's receptive and expressive language as well as any reading. And we know that there are some specific speech and language assessment tools. Your textbook does a very good job of describing which ones can be used for which situations. And as you do the ASQ and as you do the interview with the child and the parent, if there are any concerns around either receptive or expressive language, you should access the appropriate tool and further evaluate. Gross motor, this slide is a nice one that just sort of walks you through the developmental stages in gross motor related to catching a ball. And at 2, they can kind of trap it between their arms and their chest. By 3, they should be able to catch like the basketball. And 5 to 6, they should be able to catch the smaller ball. Gross motor, age 3, we said they're going up and down stairs, usually holding onto a rail. They can stand on one foot very briefly. They are jumping, they're kicking a ball, and they're pedaling their tricycle. Age 4, they should be able to balance for 4 seconds on a foot, hop on one foot, alternate their steps when they're climbing the stairs, ride a tricycle, and there's the steps, and there's the tricycle. Gross motor wise, for a 5-year-old, they begin to walk in a straight line, skipping and balancing for up to 10 seconds. Fine motor, at 2, we want them to be able to stack 2 blocks. At 3, they should be able to do 8 or more blocks. At 4, they should be able to stack 12 blocks or more. They also get a big kick in knocking them down and stacking them up again. And at 5, we expect them to be able to grasp a pencil and be able to copy like the circle and the cross. And if you're seeing a child who can't do these things, you always want to ask if they've been given the opportunity to try them. And if they haven't, the family should be encouraged to give them the opportunity and then reassess at the next visit. Fine motor, by 3, they should be able to draw a person, and we usually expect them to have at least 3 parts. They should begin with a circle and some features. Every 3 months, they should add a little something. They should be able to count 3 pennies, copy a circle and a cross, as we said. By 4, 50% of children can draw a person with 3 parts. They can name a drawing. They can count 4 pennies. And then it just continues. By 5, we expect a stick figure, and there's a little example for you in the upper right-hand corner. Most kids will draw a person with at least 8 parts. They should be able to count 10 pennies. You can encourage families to introduce clay and mud and finger paints. They should be able to turn the pages in a book, and it holds true across cultures, but you again have to make sure they're being given the opportunity. This is a good time also to use the Reach Out and Read program, and we are able in Sheridan to give each child seen for a well child visit a book and encourage the families to read to the children. It increases their language, both receptive and expressive language. Fine motor, they should use table utensils. Well, knives are probably not a good idea in this age group. They should be able to dress themselves unless it's really complicated. Use scissors. And personal social development, families should be encouraged to praise the child for good behavior and accomplishments. Talk to the child about their preschool and what they're doing, their friends and their experiences. Play with the child. Have an environment where they can explore safely, have some social time with other children, provide lots of choices because no is still pretty common and wanting their own way. So rather than saying you can't have that, offer 2 other things. Would you like to play with a ball, or would you like to play with the colors? Timeout is still an appropriate way to manage behavior and do the disciplining, and fears are real common. So sometimes parents get worried that the child's fearful, but it's very common at this age. Your physical exam, the child has a lot more confidence than they had earlier, so they may be still clingy to the parent, but usually you can get them to come around and answer some questions. Motor competence, they should have a grasp, they should have good posture and motor skills. You should be able to understand 90% of what the 3-year-old says, and it should get even better with the 4 and 5-year-old. And some kids will be real distractible, and others will be able to focus. So you want to help the child who's overstimulated by maybe getting the other distractions out of the room. If there's other siblings, maybe they can wait in the waiting room. So our routine screening for the preschooler includes their vision and hearing, lead exposure. In high-risk populations, you go ahead and get a lead level. In low-risk populations, you can do the screening questions, and they're in the Bright Futures for you. You want to screen for anemia, hyperlipidemia, and the blood pressure in kids over 3. The tuberculosis, we do a PPD if there's been exposure, clinical findings, travel to high prevalence areas if the family's homeless or someone has an HIV infection. Anticipatory guidance for the preschool age group is hand washing and limiting television to 1 to 2 hours per day. The kids should still be sleeping about 12 hours per night. Their physical activity is recommended at 1 hour per day. Stranger education is important, and also oral health, which you talked a lot about already with the cavity-free at 3. Let's say a little more about the fear and anxiety. There are some cross-cultural barriers. It's linked to cognitive development, and you can actually tell parents the fact that they have an imagination, and fears and anxieties are common because the child's cognitively growing. Their imaginary fears are a source of anxiety, and they need reassurance from the parent, and if they're in preschool, from the teachers. They can use drawings and pretend play with dolls and flashlights at night and that sort of thing to talk about how they can deal with these imaginary fears. Breath holding is a common behavior that is worrisome to families in preschool age child, and the child will become very upset and crying and then have these kind of breath holding spells that can progress all the way to unconsciousness. If you have a decreased blood flow to the brain during exaggerated inspiration or excessive expiration with the breath holding, this age child has a really flexible chest wall, and that increased inspiratory pressure can compress the superior vena cava, which decreases the blood flow to the right side of the heart and brain. And as I said, children can actually lose consciousness. So if you have decreased blood flow to the carotid arteries and then the vagal reflex, it can cause some cyanosis and pallor in the child. So this can all be very scary to the parents. They may think the child's having a seizure. So you want to get a careful history of exactly what was going on, and then reassure the families that breath holding is common. It's usually a short spell with a rapid return to normal. If there's a prolonged spell and then the child arouses and then goes to sleep, that's more suggestive of seizure activity, especially if it's involving some jerky movements and eye rolling. And either one is very stressful to the parent. So we usually get an EEG and referral depending on the history, severity, and the frequency of events. If you can sort out from the history and what they described to you that it was just a breath holding spell and that the child didn't have seizure activity, you can just reassure the family and follow them. If there's any doubt that the child actually has a seizure, they should be referred. So the parents should stay calm and provide calming reassurance to the child and try to distract the child. So let's talk a little bit about parenting and the different styles of parenting that you may see with your interaction with children and families. The authoritarian is the absolute standards, the sort of military kind of rules, and you follow the rules. And then there's the permissive, where anything goes and the child kind of gets to set their own rules and there's just few demands on them. Then there's the authoritative style, where there are clear standards, but there's a little more individuality and some open communication, warning the child that, remember, you can't do that. Remember that there's time out if you take your sister's toy away. And then there's uninvolved, which is actually the most worrisome developmental-wise for the kid. So let's talk some more about preschooler discipline. What we know is we should be consistent in approach. Parents should provide positive reinforcement. There should be consequences for undesirable behavior. The interactions that promote the positive support from parent and child are really important for the child to learn how to behave. And also the parents need to consider their own experiences with being disciplined, the child's experiences, the child's temperament, and the parent's temperament. And all of those things really will help you negotiate with this family what's the best plan. So some parents who maybe have a short fuse or, that kind of reactive temperament may need to actually do some counting and deep breathing and cooling down before they react. But sometimes counting can also give the child a few minutes to regroup and go, oh yeah, I'm gonna pay the consequences for this. There's also the contract, so there can be a reward. If you put all your toys away, we'll read a book. There's physical restraint to protect the child from harm. Certainly if they're running into the street, there's no negotiating, you just grab them. Timeout and restricting privileges works well for most children. And the rule of thumb is 1 minute per year of age. So if they're a 3-year-old, they sit on that step or that stool for 3 minutes. If they're 4, it's 4 minutes. If they're 5, it's 5 minutes. And the parent needs to be vigilant about that, because 5 minutes of trying to keep a preschooler on a chair is a long time and takes a lot of commitment on the part of the parent. Sex education is frequently an issue in this age group too. By 5, children are usually aware of gender differences, and frequently at this preschool age, the family may be adding a family member. And so the children become very curious where babies come from. The suggestions are to answer the questions they ask, be factual and concrete, but don't provide more information than they ever wanted. Most families worry about masturbation, and it's extremely common at this age. It increases when the kid's tired, hungry, or stressed, and it should discontinue when other activities, while they're distracted by something else. The child should be taught to avoid in public, and red flags for you and for the family are if this is excessive, if there's masturbation with objects, and it's also rare for children to touch each other, and so you assume that there's some inappropriate exposure going on if that's happening, or if there's provocative behavior happening in the preschool age child, because that's not a normal thing they develop on their own without some exposure. So what anticipatory guidance around play? So at the preschool age, they play beside each other but don't do as much interaction, so that's parallel play. The toddler does the solitary play. They're just playing in their own little world in their little egocentric selves. Preschoolers parallel play. They're beside each other but not really interacting, and then usually by the time they reach the end of the preschool age, there will be a little more interaction. So they frequently observe their peers and ask questions, and they'll sometimes imitate others. And as I said, as they get older, there begins to be some of this imitation and occasional interaction. And then the associative play, there's interaction and sharing that's not really organized enough to be a game. They're not really into games and rules, but they can do some borrowing and lending as they're playing. Cooperative play takes more time to develop, and it usually is the older preschooler or the school age kid, where they actually learn to take turns and they have group goals and they're more organized, but that's pretty hard for preschoolers. Make-believe play, as we've already mentioned, is very desirable for this age group. They like old clothes and simple costumes to play with. They begin to develop a sense of humor. They're more cooperative, but winning is still very important. They still struggle with the egocentrism, and so cheating to win happens very commonly, and it's just normal developmentally. They do like games. They should continue to be reading daily, either parents reading to them or them reading simple books. They like to sing songs and riddles and rhymes, and all of that helps their development. Their social competence begins to develop too, so we encourage self-quieting behaviors, encourage the expression of emotions and empathy, and consider introduction of chores, but they have to be developmentally appropriate. We don't want them to be expecting this child to do more than they're capable of at the age they are. And 3-year-olds are less negative and more cooperative than the toddler. Yay! They should still be sleeping 8 to 12 hours a night, and most preschoolers can be weaned from their nap. Bedtime rituals are really important. They help the kid wind down and also are a cue and preparation for the child. Nightmares are common at 3. The child needs to be reassured. Allow them to try to self-soothe and get back to sleep, but if they can't, just reassure them, get them back down. Toddler or a regular size bed, they may need to place it on the floor. The parental bed and co-sleeping is one of the controversies that some of you may choose to do your anticipatory guidance paper on. There certainly is some controversy around that. 2-year-olds may sing and talk themselves to sleep, may need a radio or tape recorder of familiar sounds or white noise. But by preschool age, usually if they have a bedtime routine, they can get to bed. And then sleepwalking occurs commonly around age 4. There can be safety issues with the night terrors or the sleepwalking, and you just have to help the families problem solve how to keep the child safe if they're experiencing those things. But they are pretty developmentally normal. Safety-wise, we want to remind the families that the child still needs to be in the booster seat, and smoke alarms, water safety, sunscreen, secondhand smoke exposure continues to be a problem. Not so much the SIDS now, but the increased respiratory infections. Burns are a common injury that occurs in this age group, as are poisons. The immunizations, you're going to follow that current recommendation from the CDC and the U.S. Prevention Task Force and the Immunization Committee. But as of today, it's the DPT or the DTAP number 5, IPV number 4, yearly influenza, second MMR, second varicella, and we are recommending the Prevnar or the pneumococcal, and for high-risk kids, the meningococcal. And catch-up may be required if the child has missed any of their infant or toddler visits. Red flags in the 3-year-old, if the child is having a lot of difficulty with toilet training, unable to calm themselves, unable to dress themselves, unable to take turns, unable to give their name, having trouble with matching 2 colors, or doesn't use plurals, or doesn't know at least 2 prepositions. Those are all some developmental red flags that need further exploration and assessment. If their language, the consonants are unclear, if they can't construct simple sentences, 2-3-word sentences are critical in a 3-year-old. Hold the crayon with a fist, we expect them to have better fine motor skills than that. Unable to build the tower of blocks or draw the circle or balance on 1 foot. And if they have towing that causes tripping, you can refer. But as your ortho lecturer pointed out, there are still some developmental possibilities here. The red flags for a 4-year-old, if they're withdrawn, acting out, if they stool in hiding, or any abnormal toileting behaviors and problems, unable to play games and unable to follow rules, difficulty understanding their language or understanding the prepositions, a limited vocabulary or unclear speech, certainly any abnormal behaviors like fire starting and animal cruelty, those need to be referred for family counseling immediately. Those can be significant red flags for some mental health issues. Severe shyness or persistent fears as the child progresses through the preschool age group. Difficulty separating is pretty uncommon by 4 or 5 years. Unable to count 3 objects or identify what to do if there's danger. Self-care should be present by now, so children who can't dress or feed themselves, if they can't copy a square, balance 4 seconds, or alternate steps, those are some gross motor concerns that need further workup. The red flags for a 5-year-old are sleeping problems, pulling their hair, or no friends, can't interact with other children, difficulty sharing or following rules, difficulty organizing their day. As we said in the previous, the fire starting and cruelty to animals. As soon as those are identified, refer them for family counseling. Kids who are withdrawn or sad or extreme rituals, unable to count, they should be able to count to 10 by 5. If they don't know their colors, if they can't follow simple 3-step demands, speech patterns that aren't 100% understandable at 5, those need referral. Check their hearing and referral to speech if hearing's good. If they can't identify a penny, a dime, or a nickel, and again, if they've never seen those things, they have to be exposed, but then they should remember. We've talked enough about the speech, but abnormal speech at 5 is referral. Unable to copy a triangle, unable to draw a person, and difficulty hopping or jumping are all red flags, needing further assessment and referral. So that's the end of the overview of the Well Child visit for the preschooler, and I hope you have fun with preschool visits.